Hello, may I come in?
Sure.
Great. My name's Logan. I'm going to be your nurse practitioner today. Today we're going to be doing a full head-to-toe assessment. Can you verify your last name and your date of birth?
Bellman and 0702-2003.
Great, awesome. So I verified identity of the patient. I'm going to go ahead and pull this curtain for privacy. And I'll be right back. I'm going to go wash my hands. Now this is a head-to-toe assessment, so alcohol-based hand sanitizer is appropriate, or you can wash your hands with soap and water for the appropriate 20 seconds. So, what brings you here to the hospital today?
Just a little bit of chest pain.
Oh, okay. Are you having chest pain right now?
Not really.
Okay, great. So we're gonna go ahead and start off with your vital signs. Do you have to go to the bathroom before we get started?
Nope.
Okay. Do you use any assistive devices for walking?
I do not.
Okay, great. So first, I'll take your blood pressure and your pulse ox. Might just put this on any one of your fingers. Thank you. We would normally do this right on the skin, but for the purposes of this video, we're not going to do that today. So we're going to do a two-step blood pressure. So we're just going to clip this right here. And I'm just going to actually feel your radial pulse. I'm going to squeeze it until I don't feel it anymore. Perfect. Awesome. You can just relax on there. Okay. So I didn't feel it anymore at 120, so I'm going to puff it up 30 points ahead of that 120. That'll be my starting point. Alright, so our blood pressure is 120/70. Our pulse ox is 96% on room air, and our pulse on the pulse ox is saying 80. I'm just going to confirm with our radial pulse. Also at this time, I'm just going to listen to your apical pulse just to confirm. And I would listen for 30 seconds to make sure that the radial pulse is correlating with the apical pulse and it's correlating with the pulse oximetry, which it is. Perfect. I also counted her respirations while I was doing the apical pulse. You don't want to tell the patient that you're counting respirations, and we're at 16 even and unlabored breathing pattern. I'm going to take your temperature. This is just a probe cover. I'm going to put that right underneath your armpit. Under your shirt. Perfect. You having any pain today anywhere? 0 to 10, 0 being no pain, 10 being the worst pain of your life.
Not any pain right now.
Great. So I document all the vital signs and the pain, and we're just waiting for that temperature. While we're waiting for that, do you have any tattoos, piercings, or anything other than the ear piercings that I can see?
Nope.
Okay, great. I'm gonna document those. When did you get your ears pierced?
Like a year ago.
Oh, okay, great. And they're all healed up. There's
Yeah.
no redness, swelling, edema, anything like that that would be indicative of infection. All right, I think I hear your thermometer beeping. Great, awesome. Okay, so it says 97.1, and I know axillary that I have to convert 1 Fahrenheit above the reading if it's not a thermometer that does that automatically. So I'd be documenting 98.1 axillary temp. At this time, I would go ahead and provide a full skin assessment. We are not going to do that for the video, but for the purpose of this test, I want you to know that you would take all the clothing off, try to maintain adequate privacy for the patient, give them a towel, appropriately assess parts of the skin at a time. You're looking for any lesions, any bumps, any ecchymosis, any swelling, drainage, redness, heat, edema, anything of that nature. But we're gonna skip that for today. If you found any of those things, you would describe it medically in the chart. So I would note, let's say she had a bruise on her left upper arm. I would denote ecchymosis present to the left upper extremity and then measure it. So approximately 2 inches by 2 inches, or use the metric system, 4.6 centimeters by 4.6 centimeters or whatever. Okay, so now we're gonna go ahead and I'm gonna assess the temperature of your skin. So I would do it directly to the skin. She's warm, moist, and dry. I would assess the arms, I would assess the legs, but right now we're gonna keep her closed on. You can go ahead and lay back for me. And I would do skin turgor. Ideally you wanna do this on the sternum because that is one of the last places that the body loses elasticity. I'll do it on the back of her hand to show. Okay, skin turgor within normal limits, there's no tenting. And tenting would be indicative of possibly dehydration. It could also be loss of elasticity. So now I'm gonna note the head position and symmetry. And actually feel your head, okay? Let me know if there's any pain when I'm palpating. Okay, and I'm noticing the facial symmetry is within normal limits. Any pain when I was palpating? Okay, perfect. So at that time, I'm gonna go ahead and also assess the scalp, the hair. Is there any dandruff noted? Is there any hair loss? Are there any mites or lice? And I'm not noting any of that at this time. So now I'm gonna palpate your sinuses. Let me know if you have any pain when I'm pressing. Any pain when I pressed anywhere? Okay, great. So no pain. Now I'm gonna go ahead and assess the TMG, or the temporomandibular joint. I'm gonna go ahead and place my hands on the side right by your ears. Go ahead and open and close your jaw, wag your jaw side to side. Any pain? No. Okay. And I did denote a little bit of crepitus or clicking on that right temporomandibular joint, so I would note that in the chart. So with you staying right there, I'm gonna go ahead and get a pen light. At this point, I would ask my nursing assistant to go ahead and grab me a pen light. Thank you. And I'm gonna assess the nose for patency. I'm also looking for any drainage, any swollen turbinates, and I'm not seeing anything. You're looking for nasal septal defect as well, or deviation. And I didn't notice any drainage or congestion as well. Do you have any trouble breathing in and out of your nose? Great. So now I'm gonna assess the trachea, and I'm looking, and it looks midline. It's not deviated to the left or the right. So trachea is midline. I'm gonna sit you up a little bit. Now, at this point of the assessment, we're gonna go ahead and start to assess her visual fields. Actually, we'll do lymph nodes first real quick. We'll finish up the neck. I'm gonna touch your neck on both sides, okay? Let me know if there's any pain. And I'm assessing the submandibular lymph node chain, the cervical lymph node chain, and then the auricular lymph node chain. And I'm not feeling any redness, any swelling, any hard, swollen, or enlarged lymph nodes. Do you wear glasses or contacts?
I do.
Oh, okay. Do you have your contacts in right now?
Yes, I do.
Awesome, great. Keep them in for the purposes of this assessment. Go ahead and tell me how many fingers I'm holding up.
2.
Okay, great. Okay. Yep, we're still recording. Okay. Go ahead and cover your left eye. How many fingers am I holding up?
2,
Go ahead and cover your right eye. How many fingers am I holding up?
3.
Okay, great. So that's gross visual acuity. So now I'm going to look at your sclera and conjunctiva. Go ahead and pull your own eyelids down. Perfect. And I'm not noticing any paleness of the conjunctiva or the pink part of the under eye. And I'm looking at the whiteness of the eyes. There's no jaundice. They look fine. There's no redness, no drainage. They look great. So now we're going to do the 6 cardinal fields of direction. So I want you to keep your head straight and just follow my finger with just your eyes. And I'm looking for any extraocular movements, any inability to follow my fingers with your eyes. Great. No nystagmus noted or anything like that. Did that cause you any pain at all?
Nope.
Okay. I'm going to go ahead and have you look straight ahead, and I'm just going to shine a bright light in your eyes. I'm going to look at your pupils. Okay. Pupils are equal, round, reactive to light. Go ahead and follow this with your eyes only. And they do accommodate. And it's also convergence. We assess convergence when we're doing the 6 cardinal fields of direction, and her eyes were looking appropriately evenly at the target. Go ahead and open up your mouth. And show me your teeth. Do you wear any dentures or have any dental issues?
Nope.
Okay, there's good dentition. Mucous membranes are moist. They are not pale. They are within normal limits. I did not detect any malodorous breath or any fruity breath that would be important to note on assessment. Go ahead and say ah for me. Perfect. So I'm looking at the posterior pharynx. I'm also looking, that uvula did go up, so that is part of our cranial nerve assessment that we're going to bounce back to. But I'm not noticing any white patchy areas of exudate. Everything is normal. Go ahead and move your tongue from the left to the right for me. And straight out. Perfect. And I'm noting any tongue coat as well. Again, part of this is the neuro assessment that we're going to come back to, but I like to do it at the same time. So now we're going to go through to respiratory. So for this assessment, I'm going to go ahead and keep you in this position for a moment, and I'm going to listen to the front part of your chest, then we're going to have you stand up and I'll listen to the back part. So for this one, remember the top 2 points, the apexes of the lungs, you want to use the bell of the stethoscope because those are higher pitched. Go ahead and take a deep breath for me. All right. And go ahead again. Perfect. And again, in the real world, I want you to verbalize that this will be done on the skin, but we're not going to do it for the purposes of this video. So take a few deep breaths for me every time I move the stethoscope. And go ahead and reach up to the sky for me. Take a few more deep breaths. Last set or 2. Perfect. And I'm noting for any adventitious breath sounds. Everything was easy, unlabored. Everything on auscultation was clear for this patient. We would be able to define rhonchi, crackles, wheezes, and pleural rubbing sounds and what those clinically would mean. So I'm gonna go ahead and lower the bed for a moment. Do you have any asthma or anything, any problems breathing, any shortness of breath?
Nope.
Okay. When you're ready, go ahead and swing your legs over on this side and sit on the edge of the bed right here for me. Just gonna make sure it doesn't die again. Now, every time I move the stethoscope, I want you to go ahead and take a big deep breath again. Again, we're going to use the diaphragm of the stethoscope. I'm going to have you kind of turn this way just a little bit. Yeah, that's perfect. And take a few big deep breaths. Go ahead and lift your arms up for me. Perfect. And last one. Okay, great. And same posteriorly. No adventitious breath sounds noted. And again, I use the ladder pattern to assess the lung sounds. Again, we noted her pattern of breathing was easy, regular, and unlabored. I'm just gonna feel your rib cage and ask you to take a few deep breaths for me. Big deep breath. Perfect. And one more time. Okay, so I'm noting normal expansion of the rib cage. There's no use of accessory muscles that I'm palpating. Go ahead and show me your fingers. Okay, perfect. I'm not noticing any clubbing of the finger beds, which would be a sign or symptom of prolonged hypoxemia. So now we're gonna do your heart assessment. I'll just have you sit there. You can breathe regularly, and I'm just gonna auscultate over the different points. First, we'll do the, I'm gonna have you turn a little bit towards the video actually. Yeah, first we're gonna do the aortic. Then pulmonic. Go down to Erb's point. And tricuspid. And go ahead and score a touchdown for me. Perfect. And the mitral. Perfect. And I'm listening for any murmurs, clicks, or rubs. And then I would describe what I heard, if I heard an abnormal sound, over what part of the chest assessment. So no murmurs, clicks, or rubs. Normal S1, S2. There was no S3 sound noted. While you're doing this assessment, I want you to count the apical pulse for a full 60 seconds. Again, we assessed the pulse deficit when we did our vital signs, when I listened to the apical pulse and felt her radial artery. You can do that again at this time if you prefer, or instead at this time. So now I'm gonna assess your carotid pulse. So I'm gonna just have you breathe normal and easy. And I'm just gonna take 2 fingers. And we're gonna never do both sides at the same time. I'm gonna do the other side. And it's normal. I'm gonna have you take a deep breath in and hold it, and I'm gonna auscultate for any bruit. And take a few deep breaths then. And hold it. And I'm not hearing any bruit. Breathe normal. And I didn't feel any thrill. So now I'm gonna have you lean back in the bed, and I'm gonna assess for jugular venous dissection. So I'm gonna actually have your pillow and have you lay all the way back. Perfect. I want you to look up and away about 45 degrees and relax. Perfect. And you can see the JVD right there. There is no distension. Like you can see the jugular vein and you can actually see the pulsation of her carotid artery. There's no jugular venous distension noted. So now I'm gonna go ahead and assess cap refill. So if I could just have your hands, and I'm just gonna pinch enough to blanch the fingernail bed, and then I'm watching for how fast it turns back to pink. And hers are normal, less than 3 seconds. I would also do that on the toes. So now I'm gonna go into the abdomen assessment. You can relax. I'm just gonna raise the bed. First, I'm gonna lean you all the way back and I'm just gonna assess for contour. Is there any distension noted? Is there any pulsation over where you would find a AAA or an abdominal aortic aneurysm? If there is, we're not gonna palpate the abdomen. Again, this would be done right on bare skin, but we're not going to do that for the purposes of this video. We're just gonna pull her shirt tight, but note that you would actually assess the skin. We're looking for any ascites, we're looking for abnormal veins that are noted. We're looking for contour, we're looking for scars, we're looking for ecchymosis. That is extremely important, especially in some acute abdomen cases. But for the purposes of this video, we're not gonna do that. But note that. So I'm gonna go ahead and say that the contour is normal, there's no distension, and everything is good. So now I'm going to go ahead and auscultate the abdomen first, because we always auscultate. I'm gonna start in the lower right-hand quadrant and then work clockwise. Can you point to me where your belly button is so I can identify landmarks? Perfect, thank you. You can put your arm at rest. Again, I'm gonna do a full minute in each quadrant. So pretend I did a full minute in each quadrant. I want you to be able to tell me how many vowel sounds in a minute is hypoactive, normal active, or hyperactive. And if you heard no vowel sounds, you would listen in each quadrant for how many minutes? 5. So that would be a full 20 minutes of listening to the abdomen. So now we're gonna go ahead and do some light palpation. I want you to let me know if there's any tenderness or pain when I'm doing this, okay? Any pain?
Nope.
Any pain?
Nope.
How about here? How about here? Okay, now we're gonna do a little bit of deep palpation, okay? So let me know if this hurts at all. Any pain?
Nope.
Great. Now I want you to be able to identify if she had pain when I'm coming off the abdomen, what is that term? It's gonna be rebound tenderness. So I want to ask you, have you been having any problems with your elimination of your bowels or urine?
Nope.
When was your last bowel movement?
Today, this morning.
Oh, okay. What did it look like? Any pain with defecation?
Nope.
Okay. How about your urine? Any odor, any smell, like any dark urine?
Nope.
Okay. Are you having any pain with urination or any discharge noted?
Nope.
Any redness?
Nope.
Okay, great. Is it the usual amount?
Yep.
Okay. So now we're gonna go ahead and assess pulses. I'm gonna assess the temporal pulses. And I'm also going to be able to describe pulse assessment. So they're equal plus 2 bilaterally. Now, we did carotids already. We already did them. Just note, one side at a time. You never wanna do 2 carotids at the same time. So now I'm gonna assess your radial pulses. You can actually put your hands to your side. I'll come to you and see people not responding. Okay, and they are equal plus 2 bilateral. Now I'm gonna go ahead and assess your brachial pulses. You can just go ahead and relax. And they are equal plus 2 bilateral. Now, we're skipping the femoral, but I want you to be able to identify landmarks and where the femoral pulses are. Now, we're going to go ahead and do popliteal. And that is behind the knee. And again, identify your landmarks. And they are plus 2 equal bilateral. I'm gonna go ahead and take off your Uggs here. Thank you. And we're gonna assess dorsalis pedis and posterior tibial. So just for the purposes of this video, Dorsalis pedis is on the top of the foot, posterior tibia behind the tibia. Make sure this doesn't die on us. Okay. And again, they are +2, equal, and regular. Perfect. There we go. So we described the strength and the sensation of those pulses. Now we're going to assess for signs and symptoms of a deep vein thrombosis. So I'm going to actually expose your legs. Is it okay if I roll this up? Okay. Any pain when I'm pressing on the back of the calf?
Nope.
Okay. And I'm not noticing any redness or any edema or any swelling, also known as edema. No warmth was noted when I palpated the back of the calf. We no longer do Hohmann's sign. So if you read Hohmann's sign, don't do that test. It's been shown to potentially dislodge the DVT. So now we're going to go ahead and go to cranial nerve assessment and neuro assessment. So I'm going to lower your bed here, and then I'm just going to ask you to sit on the edge of the bed for now. During my conversation with you, I've assessed your speech. You're clear, you're coherent, but can you tell me who you are?
Kelsey.
Perfect. Where are we right now?
Kent State.
Great. What's the date today?
October 30th.
35th?
31st? Something like that?
Girl, it is not Halloween. It's October 30th.
Oh.
She is ANO times 2.
Sorry.
It's okay. It's alright. Let's pretend she said the right date for the purposes of this video. It's okay. Round of applause for my volunteer. So, go ahead and tell me what we're doing today. Who am I to you and why are you here?
Professor, that's an hour, and we're doing the assessment today.
Okay. We're like ANO times 2, but that's okay. Let's pretend we're ANO times 4. So her speech is clear, coherent. We're pretending that she got all that right. I'm gonna go ahead and now assess your cranial nerves. So I wanna go ahead and remember, cranial nerve 1 is sense of smell. How you can do this on the unit is get a cup of coffee, have the patient close their eyes, smell this, tell me what it is. It's coffee, great. That's not required on this test, but I want you to know how to do it. So now we already did the visual acuity and the visual fields check, and we did Perla. So that is cranial nerves 2, 3, 4, and 6. So now we're gonna do cranial nerves 5. I'm gonna touch you lightly on both sides, and you'll let me know if it feels the same on both sides. Does that feel the same?
Yep.
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 Okay, great. So now we're already done with 1 through 6. So now we're gonna go through 7. So we can do this with just facial expression at rest. I'm also gonna ask you to raise both eyebrows. Don't let me push down. Their strength is equal, they raise appropriately. Go ahead and scrunch your eyebrows, don't let me push up. Perfect. Okay, great. Go ahead and open your chin. Yep, okay, perfect. So she's strong, we're done with that. So now we're gonna go ahead and go to, we're gonna go to 8, because we did 7 as well, because that's the facial symmetry at rest, and we did the muscles of the facial expression with the eyebrows, that was 7. So 8, I want you to look at me and close your eyes. Tell me when you hear something and on what side.
I hear it.
What side?
Left.
How about now?
I hear it. Right.
Okay, great. Great. So that we did, that was our bedside whisper test. Now, we already did the essentially 9 and 10 when we asked her to say ah, the uvula jumped up appropriately and she was able to move her tongue. So now we're gonna go ahead and do 11. I want you to go ahead and shrug your shoulders, don't let me push down. Okay, great. The strength is equal and bilateral and within normal limits. So now we're gonna go ahead and we already did the tongue. I don't remember if I asked you to wag your tongue from side to side. Go ahead and stick your tongue straight out, wag it side to side. Okay, great. Just in case I forgot that, and you can do that in this assessment. So now we did the cranial nerves. Now I'm gonna have you go ahead and get up and walk towards me and then walk back to bed. and I'm assessing the gait. So the knees are above the ankles, are above the hips, are above the shoulders. Her gait is normal. Arms swinging appropriately with the opposite leg. The arm swings forward. There's no ataxia. There's no abnormalities of the gait like a limp. There's no deviation in the gait. She's walking and able to walk in a straight line. So now I'm going to have you go ahead and stand up. You're going to pick 2 cerebellar assessments to do. First, we're going to do the Romberg. So you're going to close your eyes, put your feet all the way together, stick your arms straight out like a zombie. It's almost Halloween. And close your eyes for 30 seconds. Now, pretend we did that for a full 30 seconds. Okay, great. So you always want to make sure that you can catch the patient, steady them, tell them, you know, if you do start to feel unsteady, you can open your eyes. Now we're going to do the rapid finger test. So I want you to go ahead and do fingers to thumb, the opposite. So we're going to go ahead and do your first, and then, yep. Now do them together. So pinkies, and then go to the first finger. Yep. Yep, keep going. Okay, great. So that one was a little bit strange, so we can do another one. How about we go ahead and do heel to toe in a straight line. Take 7 paces toward me. And for this one, I'm watching for any abnormalities where she can't walk heel to toe directly in a straight line. So go ahead and walk back. There's no deviation. There's no hesitancy. She's able to balance, and she is doing okay. Okay, great. So now we're going to go ahead and have you sit on the bed. And I'm just going to raise the bed so that your feet don't touch the ground. Tell me when your feet aren't touching.
They're not touching.
Okay, great. Go ahead and scoot a little bit more forward on the bed and just relax your legs all the way. Okay. And now I'm going to assess your patellar reflexes. This doesn't hurt. Great. They were normal and reactive. I did not note any hyper or hypo reflexes. So now I'm going to go ahead and ask you to stand up, and I'm going to have you do some arm circles. Do them as big as you can, and then go backward. Now score a touchdown. You reach all the way up. Fantastic. Go ahead and zombie arms. Don't let me push down. Don't let me push up. Don't let me push in. Don't let me push out. Great. Strength is normal. Go ahead and hop back in the bed. We're going to do your legs as well. So go ahead and with your left leg, kick up to my hand. Great. How high can you kick? Great. How far out can you swing your leg? Fantastic. Okay. So go ahead and push against me. So kick up and don't let me push down. Don't let me push, don't let me push, don't let me push. Okay, great. Now do the same with the other leg. Go ahead and kick up as high as you can and then out as far as you can. Great, now kick up, don't let me push down, don't let me push down, don't let me push down. And go ahead and pull your toes up. Yep, step on the gas, and strength is equal, bilateral, and within normal limits. Go ahead and squeeze my 2 fingers as hard as you can with both hands. Great. Again, strength is great, equal, and within normal limits. So I'm going to go ahead and ask you to just, with your neck, touch your chin to your chest, and then all the way to the side, and then the other side. Oh, you can put your head up. Yeah, sorry. And then to the side, the other side. Go ahead and look back and up without hyper-reflexing your neck. Okay, great. So our range of motion of the neck is within normal limits as well. So at this time, if she had any drainage tubes, I would go ahead and make sure assess for Rita, any redness, any erythema, any edema, any drainage. The extra A is if that was an incision. Is there any adhescence issues, dehiscence issues? And then also we're going to go ahead and if there is any drainage tubes, we would make sure to note, is there any Rita at the site, so any signs of infection at the insertion site of the drainage tube, and then note the drainage, the amount, the color, any signs and symptoms of infection, like for example, if it's a Foley, Is there any pus draining in the Foley that we're noting? Is it cloudy? Is it clear? What color is it? How much is it? When was the last time it was emptied? When was the last time that Foley was changed? Etc., etc. What size is the Foley? And then we're going to note that if she did have an IV, does it look infiltrated? Is it the correct fluid? Is it going at the correct rate? Etc. And also inspect that insertion site for any signs and symptoms of infection. At this point, we're going to go ahead and conclude the head to toe exam. That's my expectations. Thank you very much, and good luck on your test off. Yay!